Next thing I want to ask you, and we are almost done. I'm not going to spend
Okay.
the rest of my life with you, like it probably feels like. Um, so rare cancer, like for example, my cancer is super duper rare. Um,
Hmm.
what are the challenges in treating rare cancers? And when you have patients with rare cancers, what is your recommendation often with them?
Well, I think that the most important thing when you're dealing with rare cancers is that because they're rare, it's hard to accumulate a lot of data, a lot of information about what the best treatment is and what the best surgery is and so forth. And so it's better in those cases to probably go to larger centers where they've seen more of those cases and have more experience in doing it. And that's one of the reasons why we share you with Duke, if you will. You know what I mean? You're seeing them, you're seeing me, and we're working together to try and do what's best for you, and putting more than one or two minds together to look at that. The problem with rare cancers, as I said, is that it's hard to get enough information together and data to support a specific treatment, if you will. And in your case, it's so rare that, what we know is more anecdotal and what's been tried and what seems to work, what doesn't work, that kind of thing.
Yeah.
But again, like I just said about the genomics of cancer, rare cancers are probably going to be more easily addressed when you're looking at individual changes within those rare tumors that now you can target. So I think that's the other thing that's an advantage that may come through or come to fruition, is that people like you that have these rare tumors may be able to still be treated in a way that's directed toward the disease that you have, rather than just looking at, well, this worked 30% of the time somewhere in this group of 6 patients or something. You know what I mean? It's looking at the individual person and their individual cancers.
Mm-hmm. So yeah, that's kind of like the next thing I want to talk to you about, was like getting a second opinion. A lot of women tell me that they're afraid to get a second opinion because they don't want to offend their doctor. And I mean, I don't think our relationship has changed one bit, Dr. G, because I got a second
Well, I
opinion.
hope not. And my feeling is that I welcome second opinions, and if someone feels they need a second opinion, they should get one. If I feel they should need a second opinion, I'm going to send them somewhere and not feel like I'm inferior or not able to deal with a certain thing. I mean, now you got to know your limitations. You know what I mean? That's what Clint said. So if you know your limitations, then you're going to do the right thing for the patient. And it comes down to, what I've learned way back and was taught is if you go back to what would you want done for your loved ones and you follow that tact, then you're going to always do the right thing.
Yeah.
Just ask yourself that question: what would I do if it were a family member, and what would I want for them? And if you can do that, then you're going to make the right decision. So that's the way I look at it.
It's a little hard hand.